and this pandemic is bringing. Absolutely. The reason why we're having such vaccine hesitance is because of systemic racism, and calling that out and acknowledging that the pains that have been inflicted upon the people of color, particularly the African American community, with the medical experimentation over the generations, and the scars that it has resulted in, is impacting our health now. So I appreciated that, and it's something that we absolutely need to address head on, so we can right some of the wrongs that have been done to our community.
It's going to be a mixed bag. I think there's a lot of hesitancy and a lot of fear about what it means, especially using the word mandatory. I think when you put that extra component on it, people start to feel threatened, and people start to feel like some of their autonomy is being taken away. And I think that gets into a whole nother realm that really doesn't have anything to do specific with COVID, but just in the way that our communities have been handled over the years. I think that the piece that was shown definitely highlighted the issue of trust. I think that there's a lot that we can do to help build trust, but I hope that the media outlets, public officials, the government also continues this conversation on their end. Because right now for our community, it's about COVID, but actually it's bigger than just COVID. And I think that this is the beginning. I hope that it's not the end. I hope that how to establish trust with the medical community continues to be on the forefront of people's minds as we move through this, and that we can position ourselves in the right way to assure our students that we are going to move through it. So I think that students are concerned. I think you have those students that are really waiting to kind of get back to quote unquote normal, and they're concerned about their loved ones, they're concerned about the people that they live with, they're concerned about restrictions, and so they definitely want to go out and get it. And then you have another group of students that are really kind of like waiting and wanting to understand a little bit more and trying to really find the golden ticket for them personally that tethers them to this effort and makes them want to go get vaccinated. And so we have a mixed bag.
So many questions and so many concerns expressed about this particular COVID vaccine for various different reasons. It's our responsibility to make sure that everyone is comfortable and understands why the recommendation is as such to get vaccinated. So spending the extra time to answer those questions, it goes beyond the office visit, making sure you're going out in the community, meeting people where they are. I know in the course of the last 6 months, I personally have done numerous webinars with different organizations throughout the community, just to get the word out and just to build that trust and answer those questions, just to make sure that when it does become available to them, they feel more comfortable about their decision. And that's our responsibility. We need to provide that comfort level and that clear understanding, and make sure that the messages are well received. And most of those messages are well received when the person looks like them. So we want to make sure that representation matters, and we respect that.
Yeah, I would say one thing that I think COVID has really done is shown how interconnected we all are. There is a variable expression of COVID. So you do get some people, and it was just like allergies, but then you get other people that, unfortunately lose their lives. And I think a lot that's going on with vaccination and wearing masks and following all of the guidelines is really just the accountability that we have with one another. It is directly affecting young people because it's affecting everyone. It's affecting grandparents, aunties, uncles, mothers, fathers. It's affecting the community as a whole. And it really is an opportunity to see yourself as part of that community, knowing that you could be spreading a virus that maybe doesn't have that much of an impact on you, but it can on your grandmother or on your best friend's uncle, other people, really seeing that community aspect of how COVID is being spread and how it's affecting our communities in general. And I think as the years go on, we will continue to see more information about financially how it's impacted us. Academically, it's definitely impacted everyone. I think that subconsciously there's this feeling of like, all of last year was a wash, you know, like in terms of grades, in terms of stress, in terms of people being able to acclimate to learning in a virtual environment. That it was just, the standards were not being met, that it was just not normal. And I think the impacts on our ability to socialize with one another. What does it mean for you to be in my bubble and not be in my bubble? We see even now as we're transitioning and things are opening that there's still a level of persistent fear in some people, and there's still a level of anxiety. And I think that it's going to be years until we can fully understand how that has impacted how we see one another, how we communicate with one another, how we live with one another. And so even if you don't think it's affecting you, because of the fact that it's a pandemic, because of the fact that it's affecting our economy, our academic system, our health system, basically every system that impacts our lives, trust me, it's affecting you.
Yeah, it's been so challenging on so many different fronts. You know, the risk of this pandemic included not only the economic, the education aspect, but yeah, the mental health. You know, we absolutely are seeing more anxiety, more depression, the social isolation, higher rates of suicide, higher rates of abuse, even something that we often forget to mention when we have been social distancing and having stay-at-home orders. Home is not always a safe place for our youth and even adults if there is abuse in the home. So all of that has definitely created, a risk of a worsening of one's mental well-being, absolutely. And so if you're not socially engaging in your support systems, whether it be school, in the community, church services, different organizations, just your friends, that is absolutely going to impact how you feel about yourself. And I'm so grateful that there are a lot of different community resources that are available to help address those things. It's just a matter of making sure that our youth and all of us are aware of those resources to tap into those resources. That's the tricky part. And I will also call out, too, that when it comes to another risk that we've seen is this, in general, an advancement of a lot of our chronic medical conditions for numerous reasons. One, the social isolation, stay-at-home orders, a lot of fear. People have delayed their medical care as a result. And so their chronic medical conditions have worsened as a result. They've even delayed cancer screenings. They've delayed their immunizations, et cetera. And we've also seen in our seniors, advancing it to the other side, a decline in their cognitive abilities as well. The social isolation and the increased risk of the anxiety and the depression is affecting all ages in very unique, different ways. So the risk versus the benefits, of this pandemic, we've seen too many of our people dying. We had to get our healthcare systems in place to appropriately respond to this virus, and the stay-at-home orders and all the restrictions needed to take place because our healthcare systems were taxed, and we weren't able to fully take care of individuals as a result. So there definitely was a benefit to it. And now we have to, unfortunately, really address the consequences and the risk that came out of it.
I love that you talked about that, and in particular the resources, right? And one of the reasons why I pulled together this group of folks, right? Because I trust Dr. Pohl is somebody I call for my personal self. I'm like, all right, I'm trying to figure out like what this means, right? Like, is it okay? Is it time for me to take my shot yet? Have they tested Black folks? I mean, some of the stuff, because I do come from that world of like, at first they were aggregating the data, and so you couldn't really tell how it was impacting people of color. So that fear, based off the fact that like, sometimes they don't care about us as much. So I said, like, what's the data? And so it took me a while before that sort of my question as I watched, right? But the idea is having her as a resource because of the organization she serves on, the work that she does, not just as a doctor, hands-on doctor, but also managing practices as well. So she has that sort of depth of understanding that I trust. But also in the building are resources on campus, right? Dr. Jones, and resources within the community. I would love for both of you to speak to resources that are available for our students that they may not know about, because if they're in Hayward or if they are connected to Cal State East Bay. Do you mind?
Yeah, sure. I could definitely start. I really think that the faculty and staff and administrators here at Cal State East Bay are concerned about COVID themselves, but concerned about their students. So we've seen an increase in the number of care reports of people saying, hey, this person in my class is struggling. Hey, I'm concerned about this person. Hey, can you reach out to that person? I think it's great that we have a very robust and active counseling department. Our counselors are available for individual counseling, couples counseling, group therapy. They even have a YouTube channel. We have an after hours number. So even if the clinic is actually closed or it's the weekend and you want to call or you want to talk or you want to, get some services, you can still stay connected. When it comes to actual physical medicine, we're doing a lot of virtual appointments, but we also do some in-person appointments. And I don't think all the students know that. I mean, we're trying to look at it from the student's perspective. And from a student's perspective, getting your birth control is an emergency. So we want to be open for that, because there's some things that you just cannot do virtually. And there's some conversations and some physical exams that we need to be face-to-face for. And so we've made ourselves available for that. So we're still open and operational. I also think that, there's been a lot of effort through wellness with the H.O.P.E pantry to give out food. We've been giving out food even here in the student health building, even when the H.O.P.E pantry was located at the RAW, which is a different location. They were still dropping off supplies over here, just in case students came over here and needed food supplies. They're open, they're willing, they're flexible. And so if you have food insecurity, even if you have housing insecurity, there are people in their departments that are set up to try to understand what your situation is and how they could be of help. So it is a matter of reaching out, but it's also a matter of us letting students know that we're here, we're available, we're open, we're active, we're concerned, and that we really are going through this together.